Here's the information that was found upon physical exam on the day of his visit to the clinic. As you'll note, his vital signs are stable, except for an irregular and elevated heart rate. Otherwise, the findings are non-remarkable. In this slide, you can see a summary of diagnostic tests and lab values. The ECG did verify that the patient was in atrial fibrillation with rapid ventricular response. Most of his lab findings were within normal limits. However, it's notable that his fasting blood glucose is elevated and his INR at 1.8 is a little lower than what is recommended for prevention of venous thrombosis. We'll address the potential reasons for the INR results and actions needed for this later in the presentation. We did notice that there was a lack of information about liver function and also lipids. We also noted it'd be important to carefully monitor the fasting blood glucose, and of course the concern would be that he might be pre-diabetic. So in putting the pieces of the medical puzzle together, it did lead logically to the diagnosis of atrial fibrillation. The cardiologist who treated this patient chose to cardiovert, which would essentially synchronize and reset his heart rate and rhythm. This would be an expected intervention if medications alone had not proved successful in maintaining a normal rate and rhythm. As we know, this procedure may not be a permanent fix to the problem, and this patient might need further intervention to address this in the future. As his primary care team, we understand that it's going to be important to review his current medications, provide appropriate education, and explore avenues of support, both family and professional, to assist this patient to manage his health needs. During this presentation, we will focus primarily on his pharmacological interventions, but we'll also address issues related to how his cognitive function will need to be factored into our approach with education. This is the list of medications being taken by this patient at the time of his visit to cardiology. This list is certainly in line with what we'd expect for a patient with a diagnosis of AFib. Use of drugs are the first-line intervention for this condition. Medications for treatment of atrial fib often include antiarrhythmic medications which help return the heart to its normal sinus rhythm or maintain normal sinus rhythm. Amiodarone is the prescribed drug in this class. Additionally, it would be expected that patients receive some kind of rate-controlling drug, which are designed to help slow the heart rate during atrial fib. This patient is on the calcium channel blocker ditilazem. Because the atria are beating rapidly and irregularly, blood flow is impeded in this condition, and the risk of clots are important to consider and treat. Use of anticoagulants are recommended because of the increased risk for abnormal clotting, leading to potential for emboli and subsequent stroke. This patient is on warfarin for this purpose. As noted in the history section, we also know that this patient has a history of hypertension, hence lisinopril, and if you'll notice, he's also on levothyroxine. We don't actually know the underlying cause for the condition, but treatment of hypothyroidism with levothyroxine must be managed carefully as it can change the metabolism of warfarin. It might be that the hypothyroidism is a result of taking amiodarone, or it could be a pre-existing condition. We'll talk about monitoring for thyroid condition and how monitoring the INR may be impacted with the warfarin. Lastly, this patient is on an atypical antipsychotic. Initially, this may be confusing because his history reports a diagnosis of depression without mention of any psychotic symptoms. Again, this is one of those gray areas in this patient's history, but we have speculated this drug might be related to behavioral stabilization, perhaps anger or aggression, that may have come about with the cognitive deficits.